Hello, hi. Thank you so much for joining us, everyone, on our VAC podcast series. Today, I'm joined by Dr. Daniel Beck from Swiss Cottage GP Surgery, and we're going to talk a little bit about the vaccine and vaccine hesitancy. So let's get going. Dr. Beck, if you could just introduce yourself, please.
Hi there, my name's Daniel Beck. I'm a GP at Swiss Cottage Surgery, as Dianne said, and I've been a GP in the local area for just around the last 11 years now, and at Swiss Cottage for the last 5. So I've worked in Haringey, I've worked in Islington, and I now work in Camden, and I live in the local area too.
Fantastic.
So if I tell you a little bit about Swiss Cottage Surgery,
yes, please.
It's a quite a large practice. We provide care to 15,000 patients, and it's an incredibly diverse population that we care for from a number of different communities. That's kind of, I think, quite representative of central London, and it's a endlessly fascinating place to work because we've got people from all kinds of different backgrounds and cultures and different languages spoken. It's a really vibrant area, and we see a real slice of London, from the most affluent to some really deprived families, and some really interesting communities. We've got a big Kosovan community. We've got a big Japanese community. We've got people from all over the place. So it's constantly so something interesting, and we're always learning.
Brilliant. Sounds great. And you know what? I know that there's been so many things. This whole COVID vaccine hesitancy landscape is changing so fast. But I'm really curious to find out a little bit more about the type of things that you're hearing from your patients. What are some of the concerns that you're hearing?
So I think it's changed as the vaccine rollout's gone on, and I guess the first thing to really emphasise is that there's been an incredibly positive response to the vaccine rollout overall. At the hubs that we're supporting, we've got a hub on Hunter Street in Bloomsbury Surgery. We've got a satellite hub at Swiss Cottage and at the Living Centre in Somerstown, and I think we've vaccinated for just around 14,000 people so far. And the enthusiasm and the positivity around it has been fantastic. I think in Camden, all of the GP hubs, I think together, have vaccinated about 70,000 people, which is a phenomenal achievement, actually. And so I think overwhelmingly the enthusiasm and the desire for people to get vaccinated and hopefully bring the pandemic and the restrictions that it's had on all of our lives has been overwhelming, and there have been really positive places to work and to help staff, because the positivity around it and the optimism that this is coming to an end are really, really palpable.
Yeah.
You asked me about what kind of questions, what kind of comments have we had, and I think that whilst overall it's been really positive, I think some people have had concerns around their specific health problems.
Yes.
Will the vaccine work for me? Will the vaccine be safe for me? Will I have a reaction to the vaccine? Those are the typical ones, and we've been having lots of conversations with people over the last few months, and I think we're in a position now where we can say, having vaccinated so many people, we can say with a much higher degree of confidence than we could at the beginning when we were just going on the information from the studies. We can now say we vaccinated all of these people, and we can be really confident that they're really safe, they're really well tolerated, and people are tolerating them fine, and they seem to be really effective. And we've seen in the real world how over the last few months the numbers locally have really dropped, and that's at least in part because of the success of the vaccine rollout.
Yeah, brilliant. And I know I'm certainly getting a lot of different concerns coming through to me from different communities, but one of them that comes to mind is this whole thing about blood clotting, and a couple of countries who have halted their vaccine rollout because of blood clotting. And actually it's worth mentioning that those vaccine rollouts now have continued, but are you hearing anything around that?
Yeah, Yeah, and it's changing all the time. So at the moment we're fielding a lot of questions around concerns around blood clots, and so I guess from my perspective and what we've said all along is that these vaccines are being incredibly closely monitored and scrutinised by the scientific community across the world, and the governments who are rolling out in charge of these vaccine rollouts. And it's only absolutely right that when concerns come up around potential side effects or complications like this blood clot risk, that it's really looked into and really investigated, because this is something that could affect all of us. And the last thing we'd want is the scientific community or the research organisations to say, no, everything's fine, and be seen as to be brushing things under the carpet. Actually, you want it to be out in the open. You want it to be properly investigated and have a bright light shone on it, so we can all have the confidence that these vaccines are safe. The kind of things that we've been saying as the data's been emerging is it does seem that there've been a small number of blood clots that may be associated with the AstraZeneca vaccine, but when you put it in the context of the numbers, I'm still incredibly confident in the safety of the vaccine. So as far as I'm aware, there've been, I think, just under 80 reported blood clots out of 20 million vaccinations of the AstraZeneca vaccine that have been given. So, 1.25 million, I think that makes it. And, when you think about the risk of having a blood clot just in our daily lives, it's not much more than that. And we know that I think the risk of having a blood clot in pregnancy is something about 1 in 1,000. So it's 250 times less likely to happen after a vaccine than it is in pregnancy. So I think when you think about it in those terms, these are incredibly rare occurrences. And whilst it's absolutely right that we're all being cautious and these are being looked into very seriously, I think that should make us more confident in the system and how it's being and how it's being handled, rather than more worried about it, because I think overall these are still incredibly safe vaccines.
Yeah.
Dan, I just wondered, would it be helpful just to talk a little bit about kind of common reactions to the vaccine?
Yes, absolutely.
I think that's another question that we're having. Yeah. So it's another conversation that we're having quite a lot of. So now we've vaccinated, we're well underway with our first vaccinations, and in some groups we're hitting 80%, 90% of people vaccinated in the older age groups or the high risk age groups, which is phenomenal really.
Wow.
And we're now moving into the second doses, and people are coming back and saying, I actually felt quite unwell after my first vaccine. I don't want my second one, or should I have my second one?
Yeah.
And I guess the first thing, there's a few things to mention there.
Okay.
One of them is we fully anticipated from the studies that people would have flu-like reactions after the vaccine. Maybe about 1 in 10, 1 in 20 people will have a significant flu-y type symptoms, feeling achy or headachy.
But that's completely normal, actually. Yeah.
It is completely normal.
Yeah.
And actually it can be a positive sign that your body is mounting a good immune response to the vaccine, generating the immunity that's going to protect you from catching COVID. So it's in a way it's a positive thing. And these reactions are always much less severe than actually having COVID would be. And what we know from the studies, and we're seeing borne out in reality, is the second dose seems to be better tolerated than the first. So if you had a strong reaction to the first vaccine, you're probably going to have a less severe one the second time. And it really is incredibly important to have that second vaccine at the time that you're invited, not saying, oh, I'll have it later on in the year. We need it now. We need it now, because what we know from these vaccines is it's that second dose that gives you a higher level of protection and also a longer lasting protection. And unless we want to see this virus bounce back come winter, and we're all plunged back into this awful situation that we've been in for the last year or more, I think that second vaccine is going to be super important. And so there's very, very few people who've had the first vaccine that I would say don't have the second one. And actually, severe reactions to the vaccine have been incredibly rare. In our hub in the first few weeks, we had really no serious reactions. We've had the ambulance crews on standby. We weren't sure, just in case people were going to get allergic reactions.
But nothing.
And it's been fantastic, actually. And I think we've gained in confidence, and hopefully the people who've had friends and family members vaccinated have all gained in confidence as we've seen that these have been really safe and really effective.
Mm-hmm. And I just wanted to talk a little bit about sort of uptakes in different communities in Camden, because we have a really diverse group of people in Camden, and I know that uptakes vary from group to group. So can you give us any information on that at all?
I think that is a really big area, and I think there has been big variation from community group from in some communities with really high uptakes, and some communities in much lower levels of uptake. And it's been really interesting trying to understand, having conversations with people, and really trying to understand why that might be.
Yeah.
And doing everything we can to support people to develop the confidence that in having the vaccines. And I think that unfortunately we know that some communities, especially Black African, Black Caribbean communities, have the lowest uptake of all, around 40, 50, 60%, and depending on which cohorts you're looking at, whether it's kind of the age bands, and you compare that with 70% or 80% in some of the Asian communities and the white ethnicity communities as well. So I think it's a real issue, because we know, and this is the kind of the great tragedy, is that we know that it's those very same communities that have been hardest hit with COVID, more likely to suffer the ill effects of a severe illness with COVID, more deaths in those communities. And it's, I think that it's touched a lot of families and a lot of lives. And it's the tragedy is that I think, with really understandable reasons based on the conversations that a lot of us have had, trust in science, trust in the medical establishment is much lower. It isn't always great in those communities, with good reasons, because I think historically there've been very notable examples where the scientific community have let those communities down. I think that's really worth acknowledging. And so I think a lot of the focus that we've been looking at recently is creating opportunities to have conversations individually, in groups, information being put out there to help people when they've got questions about their particular health conditions, or they've got questions about the vaccine safety or the vaccine effectiveness, or how quickly the vaccine's been developed, that we can have those conversations and hopefully allow people to ask the questions, to develop the confidence to go and have the vaccine.
And I think if that's one thing that we can, get from today, it's the fact that, it's okay to ask questions. Those fears are legitimate, and that actually, speaking to someone and talking it through, and rather than, I know we've had people sort of jumping on the internet trying to find the answers there, but there's people like yourself, Dr. Beck, and there's people who can give you accurate, informed information, proper information, to help you make an informed choice about what to do. I think that's really, really important. So definitely thank you for that, and especially that point you made about the second jab, because I know a lot of people, we're talking about vaccine hesitancy of people who haven't had the vaccine, but then we're also talking about vaccine hesitancy of people who have had the first one and they're like, actually I was fine before, but now you've freaked me out, I'm not going to have the second one. So that's really, really important. So what I'm going to do is I'm going to make sure I put all the information on the VAC website of where you can go to get your jabs. We've got lateral flow testing going on all over the borough, and if you know of any initiatives that are coming up, Dr. Beck, in the next coming weeks or months, please let me know, and I'll be able to put that on the VAC website.
That's brilliant, actually. I fully agree. I think there's some exciting stuff all the time happening. So we've recently had a pop-up at Queen's Crescent Community Centre, which I think was really successful. I've just been on a meeting with Heard about a vaccination bus that's going to start in a couple of weeks, that's going to drive around and really see if that can kind of be something convenient, close to where people live and work, where they can get vaccinated. no, I think you're absolutely right that there's a lot of information. There's a lot of poor quality information out there. There's a lot of
Yes.
scaremongering out there. There's a lot of stuff on social media, and I just really encourage people. That's one of the reasons why we're doing this podcast. Is there's also a huge amount of really good information out there, really reliable information out there, and I'd really just encourage people or direct people towards some of those sources of information through the VAC website, and having those conversations with your GP or with people that phone you up to discuss the COVID vaccines, to really to use those sources of information rather than someone with 100,000 Instagram followers or something like that who's maybe got a different agenda.
Yeah, brilliant. Well, you know what? Thank you so much, Dr. Beck, for your time. And as I say, these conversations are evolving and changing all the time. I'm hoping that we can do this again and address some of these other concerns later in the future. Hopefully, it will be a lot more positive, and it will be summer, and it will be great, and we'll all be out of lockdown. So thank you so much for your time. And, is there anything else that you think we should definitely be speaking to our communities out there? Anything that we've forgotten possibly?
I think the only thing that I would add is if you've got a specific concern about the vaccine with regards to your health, maybe around allergies or previous reactions, or whether the vaccine is going to work in you, those are the kind of questions that you can that you can address to your GP who knows your medical history. And hopefully will be able to, or your specialist that cares for you, and hopefully be able to get you the answers you need about the vaccine. For other general queries about the vaccine or the safety or the effectiveness, then I'd be happy to respond to if we can sort out some kind of question and answer. I'd be happy to do that, Dan.
I think that would be really good. And if there's anything on the podcast today that we didn't cover and you still have questions, then what I can do is my email is on there. If you email those questions to me at our on our Health Inequalities page, what I can do is I can I send that to you, Dr. Beck, and can your team have a look and possibly get us some answers for those?
Yeah. I'll do my best. Unless there's hundreds and hundreds, maybe that'll be a good thing. No. Happily, actually, yeah. If the questions they come to you pass them. I'll do my very best to answer them. And if there are kind of specific ones relating to people's their personal health, then maybe they're best directed at their own GP or specialist.
That's brilliant. Thank you so much for adding that. Really appreciate it. Thanks, Dr. Beck. Cheers.
Take care.